The coronavirus, popularly known as COVID-19 pandemic, has had a significant adverse impact on the global economy. Due to this, governments and non-governmental organizations around the world are implementing various fiscal measures to mitigate the adverse effects and provide reliefs for businesses and households. The struggle to survive here in Ghana is no different, especially with households in the rural communities who even had difficulties with feeding, shelter, and basic social amenities before the pandemic.
Ghana recorded its first COVID case in March, and we have since seen the effects of COVID on people, more so vulnerable people who even prior to COVID were struggling to feed because they were under the extreme poverty line. And so the economic recession due to COVID has actually made them worse off.
Oxfam in Ghana, in collaboration with some of its partners, embarked on a relief mission by assisting carefully selected households with some items. This selection was based on their vulnerability, i.e. physically challenged individuals, widows, orphans, schools, some community centers, municipal assemblies, and the aged within the working areas.
The COVID-19, it came like an impromptu something. And so many people were not really aware of this coming. But when it came, it really hit the people so hard. The economy is going down, and then people are also losing their jobs. As we are aware, Ghana, the majority of the workers are into the informal sector.
Communities within the Upper West region, especially where we've been working over the years, we've come to see the impact the COVID has had on them. We can talk of dwindling food levels within households, and especially very vulnerable households are really suffering from the COVID. Some people also access to some facilities, some services have been limited.
This pandemic has caused a lot of problems. Right now we are supposed to be in normal session, but because of the pandemic, only phone tools. So it has caused more harm, especially people in the students in the communities. They are supposed to be in school. Now, if school resume, I don't know. Some currently we are with the phone tools, and the total number, they are 18. Now we can't find some of them. Some have run to down south. Some we can't trace them. So actually, the education system is going down because of the pandemic.
Life has been very tough because it has been very scary. We are all aware. In our district, we had about 10 cases, which even devastated them more because a closer community to us, they saw the victims there. Life totally here has not been the best, and it has not been the best for a while. And with COVID coming, has made it worse than it was.
Said the affair in said the pandemic, no, a dear titania how a better we are seeing an ebiso on my Ghana so. And no, welcome. I knew Digumano. Also, a day one how at the strategy to Oxfam, and Nima Oxfam so a jitum, a boy and soya sing. Am I in your COVID relief items, Kakra, I de boy communities, no, I in Sukrum account.
And so Widows and Orphans Movement, with support from Oxfam, is actually supporting 400 widows and orphans in the Upper East region with some food items, namely rice, oil, and nose masks to help them stay safe.
In the package, contains 5 kilo rice, beans, tea, tomato, something that you can use for a basic food, a basic meal for the house.
We deliver to them some Veronica buckets and its accessories, then some hand washing soaps, and then hand tissue, which they have, really showed, and a lot of appreciation for, because they've been expecting some of these things. So it's been good for us, and it will also enhance our collaborations with them, because we have a project that we are going to implement with the District Assembly. So for us, this is a good move.
This Oxfam COVID-19 social protection project is in line in our objective of the organizations, where we support the vulnerable, to be economically empowered and to be able to challenge any other social issues that will affect their daily life.
This social support project that we are partnering Oxfam to implement, first we went into the communities. We held a consultative meeting with the social welfare and then the health directorates to assist us or help us select the community COVID-19 hotspots in the district. So they help us identify those hotspots, and then the social welfare help us to identify the vulnerable in those communities.
The idea is that these are people that are actually struggling to feed and would normally have gone to markets to make a living. However, due to COVID, they are struggling to feed and are worse off than they would usually be. And so the exercise is actually to give them some relief whilst they rebuild their resilience.
First of all, coming to identify the beneficiaries is one thing, and identifying them, as I mentioned, is regarding our interaction with them, and some feedback too we've had from people we work with, government agencies and government agencies. When we had them, we had to do a profile and engage some state actors who also partner with us, such as the Department of Social Welfare, to think around the whole response from Oxfam Ghana, how we will roll out in a way that it will get to the very people who need the support.
Currently, we are on the field, actually in Kumasi, and we've gathered data from 8 communities, which are put in 2 zones. And these communities are identified as COVID-19 flashpoints or hotspots. And so we are here with donations from Oxfam. We have partnered the Ashanti Regional Youth Network, and we are going into these 8 communities to distribute relief items.
We had about 174 cases in total, but now fortunately they have all recovered and we don't have any case as at now in the municipality. But you can see that the disease is still real and then it's still ongoing. So these items that Oxfam and the Wakam has donated this morning will go a long way to support us as a municipality, our fight against the COVID-19.
Adaklu district has been identified as one of the hotspots or districts in the Volta region, which has been affected by the impact of the COVID-19.
Our focus was women and widows. But when you look at widows, there are the vulnerable people among the women. So widows are the vulnerable of the vulnerables. So our target of getting the rice closer to them at their homes was actually a nice thing, because we all got there. You realize that even most of them couldn't have come to a central point because of their vulnerability. So taking the food to their homes, seeing where they live, listening to them expressing the stories by themselves, telling us what COVID has turned them to.
We did mapping. We identified the people, give the houses numbers. So this distribution that we are doing now, we pick the items to the various homes of the beneficiaries that we identified. We pick the items to them because some of them are bedridden, they cannot walk and come out. Some are persons with disability, the aged, people who cannot walk. So we pick those items ourselves to the various homes that we have identified.
And then yen ya no ma free Oxfam a group o ma ba ha so em say o mba hu ye say the be ya yen hwe community no mu society no mu wo mo deprive ehiafo a wo mo ho ekunafo a wo mo ho ne anyankafo a wo mo ho say the be ya wo mo ekro mo sem package a o mpese wo mo de be che wo mo na in fact to yansa fro wo mo ka che wo say dwumadie say na ekoso wo hu ani gie ani say the amanfo e kan mo e ba ha ba baji sa dwumadie e ba baji sa package a e ya mo ka kwa
tal me to galela na lo me pa gbelela e cha pae gale cha pae ake dolele hevala mega pon kambre ka lewawa akopele no adu e ba no sese na m e fo ncho chomale de bioji ko tabazo eno nyo to agba
la ka bona ko ona tay wal nya sala na king da ala to ko wala to lemna de la fu ka bona ko bara lokla da ye man da ye zi di kin ligle 10 am to ko tala
ana ba tama no agbelede aka fia gusu bo ba lam ma kita ko rinka ozo ko ma ge to zo time magala doro ka wa nya ye to mo ma doro ko magala ta ne ba amare nan dira mo alo tinya do ko de ko na mla ko bo apo nan vivi mano ya gira vivi ape vivi de viva ge do tam ba gbelga do mo ana ba ndo bi de ka magala sinya sigbo ta magala sikeru wa men ga do bi de ko magala.
The COVID-19 relief items included bags of rice, cooking oil, Veronica buckets, packs of tissue, sanitizers, nose masks, posters, and liquid soap. This gesture impacted these beneficiaries a great deal. Through interviews, they told their stories, then expressed their individual sentiments and words of heartfelt gratitude. The partners during the distribution process were also very interactive and empathetic with the beneficiaries, as some cried, others laughed, and some were in awe of the items they received from Oxfam and its partners because they never expected them. These items will go a long way to serve as a relief intended for most of these beneficiaries. At the end of the distribution process, all the beneficiaries in one voice but different dialects expressed their gratitude to Oxfam in Ghana and their partners.
I used to be an attendant at the front shop. It's not easy because when I was in Takrady, things was okay, but when I came here, it's not easy for me and my siblings. When my mom was there, she was the one who was taking care of my siblings, and I was also working to support her. But I lost my job the following weekend. I lost my mom too as well. So it's not easy for me at all with them. I was having an uncle who used to support her, but because of the COVID, when you also call him, he will be saying job is not like the first, so it affects us a lot.
Nto maga value evyo chikpokpo sesana tama ka dolela va ashide daga maga value tarko ya hasasa ta fifia kami va enyu chawi kemil dolela pa kuki ma vai.
The presentation from Oxfam through Pronet to Kamba RCJSS. I am very happy for the presentation given. This pandemic, COVID-19, you people have provided us with nose mask and then Veronica bucket. This will enable us to wash our hands regularly The nose mask given, it will help us protect ourselves against the pandemic.
We've received the items and we are most grateful. At least it will go a long way to keep the protocols in respect of COVID-19 observed. We are very, very grateful, and we want to say that we expect more of this. I know Oxfam nationwide, I've attended their workshops, their meetings. They are in this business of building our capacities and doing other social interventions. We say we are grateful together with Friends of the Nation. We want to say that this collaboration should be deepened.
Na so ya de ma hwan. Da ma be hina wa ta yechi. Ma wa za ma hen. De yan fa ma ya ho ban. You good ya de bo. Ama ma de wa je ma men se no de hwan wo ho. Na wa san so je fofu wa ja ba. Nti wa ja ba yusum. Process ya gba fanfan.
Position abadon ko la mi se COVID-19 me la mi se mi le jiru le ma ka ke de kon va du fia o ka o yo mi avio na yo mi fio na o a to a mo zu e ko la to me ta da ko na ma unto be mi dia ni ko re no do mi na mo se be la mo la ho bo ta ba o re ya mi ta mo po jo le jiru ro
ye kra de o ma ya ma ye ye ni na so wo mo be ye sa de na ma ye nti achade amode abre no eye yense eye medenso sanse na mani nna se mo be ye sa de na ma nti wakamfo ne Oxfam medamo ase wade pa amaye e de amaye medamo ase pa nyame e sira mo
emom de ne ani nna nti ade wo ya amaye ndi e de na ase kese ema Oxfam ene wakamfo empanifo se ye damase Yami inshramu.
I am much grateful for the presentation on behalf of the school management, especially the headmaster, and then my college staff.
I and my colleagues thank Oxfam and ProNet for coming to our school and providing us Veronica buckets and nose masks to use the nose mask to prevent coronavirus and use the Veronica buckets to wash our hands. We thank Oxfam and ProNet very much.
Wodema kana menya bondi abarka watane kana njavur bebe kana kama mbatar ndaba man ba barbaza teke kamazon matu chinji kandra bo ngwa yo me nyanya pa wodi kana bo dema de barka on ndupo de nom ya kone nana ta barka o ya mamba ta barka kana ba kai akona komana nyanga ma pa na bandra ba yama mamba bola odo nyanga wa nyanga shor ko yu kana ba ka me me yo ya ndele akwate no komana ka barka watani ka jerma ta ka namta na tar barka yo ya mamla ta yo ne be dema no kan men ba na ma kwanne salpo to konte na ko mana nye na padi ba njare mamla ta ndere ko karme
COVID ba e juma tam akofo ti nyame ya duma modi ya be dum ye no e be boye
nyama na ye dia bibre no e be boye eni me mane.
Basically, the project has been very impactful. So as you can all witness today, we've been to Ablon, where the beneficiaries there, 20 beneficiaries, already received the food items as relief items that was given to them, and also some of the PPEs for their use during their engagement to avoid the infection. So because during the period of the COVID-19, especially the vulnerable, couldn't have any source of income to sustain themselves, and even those who were looking after them to also were not having the means any longer to look after them. So Oxfam coming in with this food item, we think is timely and it has been very impactful.